at the Association for Coaching and with your working group, we have been on a journey, I would say, in terms of raising awareness around these topics, all the things that you have already mentioned. And you mentioned in the beginning of our conversation, there was a survey that we've done last year. I know we did together last year a research webinar, and then another one when we shared the insights from that. There were a number of the webinars on the topic of mental health, the various aspects of it that we've done. A podcast series that we put out. It was released earlier this spring, and we are now coming to the moment where we are launching a conference around mental health and well-being and how these things appear in coaching and supervision, which will take place in November. So it's, I would call it a journey. What do you think, and how? What was this all about? Let's share with people.
Absolutely fabulous, because we set up, or I set up and lead the mental health wellbeing working party. We actually started work in 2021, and we're now in 24. But that, as you say, it's required a lot of research, a lot of finding out what do members want. So it's just, this year is so fabulous because everything is being implemented. We're seeing the results of all the work, and I think what's important is that we're covering the key topics that we identified, that came through on the research, which are around anxiety and stress, overwhelm, burnout, relationship issues, particularly neurodiversity, where we've got Esther is going to be talking. We've got a special LinkedIn Live. We've also got Nancy Doyle later on in November. And also we have other topics that were coming that have come through. We've got a panel of people who are well known in their field, opening and closing, who are going to bring their insights. We have individuals talking. We have Francis Masters on the fusion model. We have myself and Joe Birch, who are talking about supervision. I'm thinking about other topics. We've got loss and grief, where we've got Julia Manall, self-care for coaches and supervisors, coaching for recovery, and working sort of safely with stress, anxiety, and depression, and then opportunity for reflection and picking up on those key issues. So it's a fabulous bringing together of all the work we've been doing through the year. And we've also produced, last year we produced guidelines of best practice for mental health and well-being for supervisors. They are now on the website, so anybody in the audience can access those too as a resource, and we're producing further guides. So I'm really pleased with the progress that we've made, and I'm sure members will really appreciate that there are the resources there. The main thing to remember, though, is that there are opportunities to think through in the various steps to take. For example, just as a summary, making sure in the chemistry discussion, if it's the first session, what are some flags that are coming through? Thinking about the client needs, what needs to be in the contract, considerations, confidentiality, your capability. And many coaches feel, I think, they want to be solution focused. They want to provide a solution. They want to do. This is about being, holding the person in the moment and listening, reflecting, clarifying, and offering options, and thinking about what opportunities are there if things do come up in the room, to be with the person, but also discuss, share options and possibilities, rather than saying, I don't know enough about this, I need to refer. That could actually mean what you might call a rupture in the relationship. So you need to handle it very carefully. And then once those options have been discussed, think about asking permission for things to come out of the room if there is a risk or possibility of harm to self and others. and then referring and having a checklist, which we're now putting using onto the website, of what to do and various agencies that people can contact in their various jurisdictions in case of crisis, and then, you know, agreeing next steps and actions and follow-up, so the person is contained, is held, and feels that they have been listened to, acknowledged and validated, which is the most important thing, is that sometimes doing less is actually more, and listening is one of the most important qualities.